One of the biggest points of confusion when it comes to facelift is what type of facelift. And there's two categories of how people characterize a facelift. One is based on, is it upper, is it mid, is it lower, is it full? So much confusion that. The other is what type of lift as far as skin, SMAS, deep plane. So let's start with location. When people call it a full facelift, sometimes they come in and they think that it's the entire face. A full facelift for most, and again, this is going to change depending on the surgeon and what you read, but for most, a full facelift means lifting this part, the mid face, the lower face, as well as the neck. Technically, this is a neck lift, but if you're doing a facelift the correct way, all of this is coming up together as one big unit. So, for most people, a full facelift means elevating all of this. This part here, above this portion, is a brow lift because now we're addressing the brows. It's done a little bit differently, some of the similar concepts, but this is a lateral brow and this is kind of a full brow lift. We talk about brow lift separately because there's a lot of misunderstanding about brow lift, but facelift, brow lift. What some surgeons will do is they're going to call it their own kind of brand of a facelift, and they will do what they think is appropriate for you, combining the different procedures. But to be clear, a facelift will typically refer to this. Now, what is a mid facelift? That means that you don't really need to do the neck or so much of the lower face, and this is when people are really just focused on this area here. Lower, typically that refers to more of the jawline. So a lower facelift, it's hard to do a good lower facelift without really addressing the neck. So for me, a lower facelift really means kind of like an extended neck lift along with this part of the neck. These are all very specific types of facelifts or specific areas, and they're really on a case-to-case basis. Patients call all the time and they want a specific lift, but you really have to analyze the face and you have to see what that's going to do for you, because sometimes if you just do one area, you're going to get pleating and redundancy in other areas. But for definition purposes, that's what we mean when we refer to those. So what are these mini lifts or minimally invasive lifts? This is going to mean something different with every single surgeon. For some, a mini lift means doing less work, meaning when we are lifting the skin, they're only lifting the skin a little bit and they're pulling it a little bit, meaning they're doing less of the procedure. For others, a mini lift refers to how extensive the scar is or the incision, because in a good facelift, we really barely get any sort of scars. So they are talking about just incising here. And yes, you can sometimes accomplish some things with that if somebody just needs a little bit of a lift over here. So when we're talking about mini, it's a very elusive term. For some, it's going to mean just dissecting, meaning lifting up less skin. For others, it's going to mean a smaller incision. Then we get into the part that people really, really misunderstand and really want to understand better, and that is the extent of the facelift. First of all, skin only lifts, those were abandoned, and I think there's kind of a consensus among surgeons that that really should not be done. Unfortunately, it still is, and that is where you're just lifting the skin and you're pulling on the skin. It may look good for a day, two, few weeks. The problem with those is the skin is not the problem. What you're doing in those lifts is you're taking the skin and you're pulling it along with all the layers underneath, and you're using the skin, a layer that is the most superficial and thinnest, in order to pull everything up. Well, what's going to happen with something like that is the skin will pull back. And over time, especially as you move facial expressions, those scars are going to become very wide, and those will be scars, not just little incision lines. The ear is going to pull forward. Sometimes the hairline. If they incised up into the hairline, then you're going to lose some hairline and still lose some hair over there because you're going to lead with tension in those areas. The next is the SMAS lift. So the SMAS lift has really been kind of the standard for a few decades. It's really where we're lifting the skin, and now we're addressing that true layer, the SMAS layer. Those are all some will refer to it as muscle. It's not truly the muscle in the face. It's really that fascia, which is a very strong layer that encompasses all those fat pads that we're lifting up, because we're not lifting the muscle, we're lifting the fat. However, when we get into the neck, that SMAS is part of a muscle, big flat muscle called the platysma here. So yes, it's kind of a muscle layer, but really what you need to know is it's that main layer, that SMAS layer is the main layer that has all the strength and holds all of those fat pads that really give our face the shape And those are the ones that actually descend with time. So the SMAS lift, we're lifting the skin and then we're pulling on that layer. Now, the problem with the SMAS, and it's been, like I said, kind of the standard of facelifting for a while, but the problems that we've seen is that it's still attached down below and it's still attached to the facial muscles, the muscle of expression, as well as to some of these deep ligament structures, the ones that are really adherent to the bone. And when you pull it, sometimes you're getting a little bit of unwanted deformities, especially down here, you're getting a little bit of that swept look because it's still attached and you're pulling against those forces. The difference with the deep plane lift is we're only going to lift the skin a little bit and then we're going to dive deeper to the SMAS. I have some other videos really explaining exactly what a deep plane lift is, but because we're only lifting a little bit of skin and we're going another layer deeper, we have a really nice, good, solid hold on it, and we're releasing it from those attachments to the muscles below and the ligaments below. So now we're not pulling on the SMAS. A SMAS lift, yes, it addresses the SMAS, but it pulls on the SMAS. Here, we're lifting the SMAS and then we're placing it. So there's no pull on it. And if you ever can watch one of the intraoperative surgical videos, you'll see that with this, we're just lifting it, we're placing it. We're actually placing it back to where it naturally belongs. And this is why you get such a nice, good longevity and natural result with this, because we're able to lift it, there's no tension, and then we suture it right in that spot. The skin comes along with it. So we're not worried about skin. Once we're done with the main part of our SMAS lift, the skin lays down, and just like a tailor would, we tailor it, we don't pull it, we don't stretch it. So that's what a deep plane lift is. This is just kind of an overview. There are other videos where I go into some more depth, especially with a deep plane lift, to help explain. Some of them are surgical videos. Some I've tried to use some mannequins to really help explain these concepts better, but this will give you an overview of what are these different types of facelifts.